Autumn is in full swing, and so are high school athletes. On practice fields, we see athletes involved in football, lacrosse, field hockey, and track. On the sidelines, we see parents who are hoping for seasons that are filled with wins and light on sports injuries. I'm Ann Dillon, and this is HealthLine. With me today is Dr. Doug Evans. Dr. Evans is a sports medicine specialist at Loyola University Health System. He has served as team physician for the University of Buffalo, the University of Chicago, and is currently the team physician for the Loyola Ramblers. Welcome, Dr. Evans.
Thank you.
I'd like to start with football because certainly it's on everyone's mind. I would like to ask you about a study that you told me about recently that showed that overall, even though college football players have more injuries overall, that high school athletes are actually hurt more seriously. Why is that?
Well, I think it's multifactorial, really, but I think certainly there are a number of the factors are that high school athletes tend to be in slightly poorer condition than the college level athletes and the professional athletes. So they're not ready to absorb those injuries like the higher level athletes can. In addition, there's also some techniques that the college and professional level athletes are able to master to protect themselves as they go along. So I think the conditioning and the techniques together play a big part in why the high school athlete is injured more frequently than the older athletes.
And what are the most common injuries that we see in football?
Well, as you can imagine, in any contact sport, there are a wide range of injuries that we see in football. And just like any other sport, most of those injuries are the more minor injuries, sprains and strains, contusions, things like that. Football also, unfortunately, is the largest generator of more significant or serious injuries as well. Things like neck injuries and concussions and other more major injuries that cause the athletes to lose a lot of time on the field.
A lot of us have dealt with sprains and strains. How do you determine when it just needs rest and ice and elevation and when it requires a trip to the emergency room?
Well, again, because there is such a wide range of these injuries, it's individual for each injury and each incidence. But certainly there are certain factors that you can look at if, for instance, an athlete is unable to bear weight on an injured leg or is unable to move joints in his upper extremity. Those are concerning symptoms. And obviously if you have symptoms that are worsening with time rather than improving with time, that would be concerning as well. Any kind of loss of consciousness or something along those lines, that certainly warrants a trip to the emergency room just to make sure that everything's in working order. And if you have a doctor on the field or a trainer on the field, sometimes those decisions are really better left to the healthcare professional that's there.
Okay. Someone goes down and they're unconscious, and we're assuming it's a concussion. Concussion is one of the scariest of the sports injuries. What should we know about concussion?
Well, concussion is scary. There are obviously a number of athletes that have ended their careers, professional athletes that have ended their professional careers secondary to concussion and post-concussion syndrome. The main thing to understand with concussion is that it's nothing to be taken too lightly. There's a number of very significant, very severe consequences if concussions are not treated appropriately, and that's why these professional athletes are ending their careers after multiple concussions.
And is there any new knowledge in the world of conditioning or training? training, that will help us cut down on some of these football injuries?
Well, the most significant recent, well, I guess it's not so recent anymore, but back in 1976, there was a rule enacted outlawing spearing in football. And this cut down very significantly on head and neck injuries in professional athletes, or excuse me, an any level athlete. But also there have been a number of equipment changes and things like that. For instance, rather recently they've introduced a new helmet for football players that's supposed to lower concussions, or lower the incidence of concussions for all levels of football athletes. We also use some neck protection and some other equipment that seems to be doing a pretty good job at decreasing significant injury for football players specifically, but really we're doing it in a lot of different sports as well.
For those of us who aren't sure, what is spearing?
Spearing specifically is traditionally, or years ago, the football players were told to put their forehead into the numbers of the player that they're tackling. It was a good way to not miss. But unfortunately, that position of putting the head up and driving the head directly into another player puts the cervical spine at very significant risk. So they outlawed that hitting of the point of the head into the player's chest. Now, to make a tackle, they're supposed to use their shoulders rather than their head.
And when we see a player fall down, a lot of times we see them clutching a knee and rolling on the ground. And certainly knee injury is something that we have to be concerned about too. Is knee injury as big of a threat in football as other sports?
Football is certainly a large generator of knee injuries, just like all different types of injury in contact sports. But football is certainly a generator, as well as other sports like soccer, basketball, any kind of running, jumping sport or contact sport.
Hold that thought. We're going to talk about knee injury more when we come back. We're going to take a break. Thank you. Hi, we're back again with Dr. Doug Evans, sports medicine specialist from Loyola University Health System. We were talking about knee injury, and Allison from our audience asks, do the studies related to knee include women athletes too? Do women have to worry about knee injury in the sports that they compete in?
Actually, this is a real hot button topic right now. There's been a lot of recent interest in this because we've got a number of good studies showing that women athletes are much more likely to have ACL injuries or anterior cruciate ligament injuries than their male counterparts.
I need to stop you there because I don't know what the anterior cruciate ligament is. Can you help me with that one?
Sure. The anterior cruciate ligament is one of the main ligaments of the knee. There are essentially four main ligaments in the knee. There's an interior ligament of the knee called the medial collateral ligament, and outside the lateral collateral ligament. And then in the middle of the knee there are two crossed or cruciate ligaments, one in front, the anterior cruciate, and then one in back, the posterior cruciate. The anterior cruciate is much more at risk for injury, especially in non-contact mechanisms such as twisting, and also in some contact issues where athletes are hit either on the inside or outside of their knee.
And female athletes are especially vulnerable?
Female athletes do seem to be, at least epidemiologically, much more susceptible to this kind of injury. The exact cause of that is not really certain. There have been several considerations as to why that might be true, whether it's a hormonal factor or a anatomic factor, that perhaps their ligament is placed differently or is of a different caliber than their male counterparts compared with their body weight, although these things haven't really borne out very well. But there does seem to be a biomechanical advantage to the way men move and jump and land, especially in sports, that seems to protect their knees against an ACL injury.
So women land differently?
Women tend to move side to side in a more erect posture. They tend to land with their knees in more than out. And both of those things can put their anterior cruciate ligaments at injury, or at risk for injury, excuse me.
Are coaches a little bit more aware of this, and are they doing anything to try to prevent it from happening?
Certainly, with all the recent interest on this, there's been a lot of interest in how to prevent these injuries for these female athletes. And there's been a number of recent studies showing that with different training programs, it's possible to lower the incidence of injury to the anterior cruciate ligament in female athletes.
And what is the treatment if you have an ACL injury? What happens next?
Well, for most young, active folks who are participating actively in sports that require cutting and pivoting, the treatment is generally surgical. It's a reconstruction of that ligament. Unfortunately, because of the location of the ligament and what it does, it's not possible to just suture it back together and have it heal. So we actually have to replace it with other tissue, frequently either from the athlete's hamstring or from their patellar tendon. For some folks who don't participate in cutting pivoting activities or who live more sedentary lifestyles, some of those folks are able to be treated non-operatively.
And how big of an operation is that? Are you awake the whole time? What happens?
Well, it depends a little bit on surgeon preference, but certainly it can be done with the patient awake with a block of either the leg or a spinal block. But for the most part, people tend to have an anesthesia that causes them to sleep through the procedure. It's tough to operate on them while they're moving around. But the surgery itself lasts anywhere between an hour and a half and 2.5 hours, depending on what needs to be done. And the recovery time can be somewhat varied, but usually within a few weeks the knee is starting to feel better. Usually around 6 to 8 weeks you're walking pretty normally. By 3 months you're back to running and most activities, and we usually return them back to full contact sports around 6 months.
And how big are the scars?
Well, the scars these days are getting smaller and smaller. There's a lot of interest in doing this in a quote-unquote minimally invasive fashion. So most of what we do is arthroscopic with smaller 1 centimeter kind of incisions, and obviously there's got to be a larger incision to harvest the graft from if you use the hamstring or for the patellar tendon, and also to place the graft into the knee.
And when you say a graft, what are we talking about?
The graft is the tissue that's used to reconstruct the anterior cruciate ligament.
Okay, we're going to take a break. Thank you, and we'll be back. We're back, and we've been talking to Dr. Doug Evans, sports medicine specialist at Loyola University Health System. We had a question from the audience, from Julie, asking what's the best way to heal an injury? And I know that that's a big concern. If you've been injured, you've been out, maybe you've even had surgery, how do you know when you're really ready to go back on the playing field?
Well, obviously my answer to that question is going to be when your doctor tells you you're ready to go back. But truthfully, there are a lot of good indications, especially with athletics. It's important that not only do you have full motion and no pain, but also have full strength back in that extremity or that joint so that you can protect yourself against further injury down the line.
What happens if you go back too quickly?
That's a big concern, and especially for athletes who are in season, they want to get back as quickly as they can. And when they return too quickly, frequently they do re-injure or aggravate the problem that caused them to miss the time. So it is important to make sure that you're really ready to return back to athletics before you actually return to participation.
Is there just a formula for getting back if you're going to give yourself the best chance of rehabilitation and gameplay again? What do you do? What's the winning formula?
Well, the winning formula for getting back is really just making sure that you're ready to return and making sure that you're in top performance shape and protected against other injuries and re-aggravating the injury that caused you to miss the time that you had previously missed.
Mm-hmm. I was going to take another question here from our audience, and Julie asks, after how many injuries should you stop doing athletics?
Well, this is also a very salient topic. There are, with the number of athletes that are ending their careers because of multiple injuries, either to one body part, for instance, professional football players like Jerome Bettis, who, at the end of their careers had so many knee injuries that they had difficulty walking, and athletes like Muhammad Ali, who after so many concussions is having difficulty with cognition and normal everyday kind of tasks. You want to limit the number of injuries, especially the number of recurrent injuries to the same kind of body part, so that you aren't left with prolonged difficulties after you're done participating in that sport.
But you said the good news is that we're fixing them better, right?
With every passing year, I think that we get better at diagnosing these injuries and healing them and getting them back to participation. An excellent example of that is ACL injuries. Many years ago, that was the so-called trick knee, and nobody really understood what the ACL injury was and how it affected knees, and that led to a lot of folks having some pretty significant arthritis in their knees.
I'm glad we've gotten better. Tricia from the audience had another question, and she asks, what's the most frequent injury that occurs in sports?
The most frequent injury is likely sprains and strains of some sort. Probably an ankle sprain would be the most likely or most common injury, just because of the number of athletes participating in sports like basketball, volleyball, things like that, where a twisted ankle is so very common.
Mm-hmm. And they can blow up like balloons too and scare you.
They can be very significant injuries, certainly.
Okay. What about the surgery for this? When someone goes in for surgery, how long should they expect to stay down?
It depends on the injury.
An ACL repair, let's say.
Well, an ACL repair or reconstruction generally will keep you out of contact sports for about 6 months, give or take, and that does have something to do with surgeon preference. So different doctors will give you different time limits. But my general rule of thumb is 6 months for return back to contact sports. But you can be back to running, biking, swimming, things like that much sooner after an ACL injury.
How about an ankle sprain? What's the magic formula?
Well, an ankle sprain, because they can be everything from a little twisted ankle to a completely torn ligamentous injury, and there's also recurrent ankle sprains as well. So the downtime with an ankle sprain can be significantly different, anything from a few days to missed seasons.
Okay. And what about, say, a shoulder injury?
Well, the shoulder injuries, frequently, the most common shoulder injury is probably a dislocated shoulder. Mm-hmm. And a first-time dislocator sometimes can be back in a couple of weeks after some proper rehabilitation. But a recurrent dislocator, or certainly anybody who's had surgery, is going to be out for a longer period of time.
So weeks, months? Weeks
to months, could be even just a few days. Sometimes we just get contusions around the shoulder and they're back playing at the next practice or game.
Well, that's good to know. There's a lot of good news coming out of the world of surgery for sports injuries. We're going to take a break. We're back again with Dr. Doug Evans from Loyola University Health System. He's a sports medicine specialist. Dr. Evans, we've talked about football injuries and what it takes to get back in the game. We've talked about basketball injuries and how it seems that female athletes are having more of a difficult time with ACL injuries, maybe because they're not landing properly. And we've also talked about some of the newer surgeries and how they are helping athletes get back into the swing of things faster. If you were to bottom line it for us, what is the winning formula? What is the way that someone can get back into play the quickest after an injury?
Well, I think the best advice on that is proper pre-injury conditioning, so staying in good condition at all times while you're participating in an athletic endeavor. And then while you're hurt and you've got an injury, you can cross-train and keep your cardiovascular status strong. And then when things are finally healed up to the point where you can strengthen that extremity and get that extremity back into playing shape, it's important not to return too early until you're really ready to get back into the game.
We had one final question from Allison, who asked about ice, relaxation, and rest, and exercising if you have an injury. I think a lot of people think that you shouldn't exercise, but tell us what the formula is there.
Well, and that's an excellent question. Really, it's very important, especially for high-level athletes, to maintain their conditioning while they're injured. So, even if you have an injury, doesn't mean that you're sitting down doing nothing. You really should be keeping your cardiovascular status healthy and keeping your muscle conditioned as best you can, so that when you do heal the injury, you're able to get back in and play at the same level that you were playing at before. So
you need to keep moving, is that it?
Keeping moving is very important.
Okay. And in terms of trying to diagnose yourself, what about the athlete who says, I'm okay, I can manage, I'll just give it a little ice, a little time, and I'll be back at practice by the end of the week?
Well, a lot of times the athlete is sometimes the only one who knows how hurt they really are. The one exemption to that rule is concussions, and a concussed athlete really will tell you they feel fine and want to get back in the game, but can be really quite dangerous for them to return back to the game with a concussion.
Do you ever find that you're in conflict with coaches? Do sports medicine specialists and coaches sometimes have to have a disagreement?
Well, it's never a disagreement. It's more of a difference of goals and objectives. And obviously the coaches want to get their athletes back in and get them playing again as soon as possible. And the physician sometimes has to make sure that the athlete's really ready to return before they get back in.
Okay. Well, I'd like to thank you. This is Dr. Doug Evans from Loyola University Health System. He's a sports medicine specialist in the Department of Orthopedics and Rehabilitation. Thank you, Dr. Evans.
Thank you.
This is HealthLine, and I'm Ann Dillon. Thank you for joining us.